Hello, this is David Schwab, and I recently had the great experience of interviewing Dr. Andrew Alpert. Dr. Alpert is a periodontist in Aventura, Florida. We conducted the interview via Skype. Dr. Alpert provided just great answers to frequently asked questions. Here's a portion of that interview. Many patients are interested in dental implants, but they may be concerned about the procedure. How do you keep the patients comfortable during and after the placement of dental implants?
Oh, that's a great question. So first, let's talk about during the procedure. We have a tremendous number of patients that we see that have high anxiety about having this procedure done. They've heard all kinds of horror stories about the surgery. The first thing to do is let them know that dental implant surgery is very gentle, it's very kind to the tissues, it's a much easier surgery on the patient than they would think it is. Then we give them preoperative medication so that they're relaxed during the treatment. We, of course, give them local anesthesia, that goes without saying. And we use nitrous oxide, that's an aid to help them feel more relaxed. And then we often give them some injections in the arm, for instance, Demerol, we use that. Now, we also can take it a step higher and we use IV sedation. We work with a nurse anesthetist and we sedate the patient. That means that they're still breathing on their own, but they're really kind of in la-la land, and they call it a twilight sleep, and they really like that. And then we have the next level, which is general anesthesia. This is for the patients that say, I just want to be put to sleep. So we do that. We put them to sleep with general anesthesia. We're working with my nurse anesthetist. So that's all the stuff during. Then afterwards, we control them with post-op pain medication. They should use ice, immediately after the surgery for the first couple of days. We provide them at times with anti-inflammatory medication, and they need to take it typically for 3, 4, 5 days or so. It does not go on for weeks and weeks and weeks. As I said, it's general surgery, and there's tremendously less discomfort than patients anticipate. We hear that all the time.
I understand that some patients don't even have to take all their pain medication after implant placement because they feel that they don't need it.
Well, I could have probably a whole shelf of pharmaceuticals in my office for patients that want to return the pain medications that we gave them. They come back to us and they say, I really didn't need all that pain medication you prescribed. And I tell them that's wonderful. And they say, well, you must have been a great surgeon. And I say to them, no, you're a great patient. Actually, we make a great team. So many, many, many times they come back and say, I only had to take it for a day or two. But after that, I just took some Tylenol or aspirin, and that took a couple of days of that. And then after that, I didn't take anything at all. You're amazing.
I want to thank Dr. Alpert for joining us today and sharing his expertise. Dr. Alpert is accepting new patients, and he may be contacted through his website, alpertdentalimplants.com. This is David Schwab. Thanks for watching.